Hey there, Dr. Andrew Grecki, physical therapist. People typically come to me when they're looking for a natural solution to their back pain and they want to avoid medications, injections, and surgery, and I help them, but not how you might think. But before I get started today, if you like what I'm talking about and you want to find a natural solution to your back pain, you're serious about finding a natural solution, and you want to avoid medications, injections, and surgeries, I would encourage you to give me a call at Superior Physical Therapy, 231-649-2015, and we can have a quick, brief conversation, and I can help you understand whether or not I can help you. Okay, so today I want to talk with somebody who's got back pain, and you've just done the injections, right? The cortisone injections, the anti-inflammatory injections. I've been there myself. Back in 2004, I had a major back injury where I herniated a disc, and I had over 18 months of treatment. And I went through my 1, 2, and 3 cortisone injections over a period of time. Well, you've done your first one, maybe you've done your second one, maybe you've done your third one. Typically, when you have your first one, if you call them up and you say, hey, I'm not feeling much better, they're going to recommend 3 over like a 2 or 3 month period of time. And if you're like most people, it didn't really help you, which is pretty frustrating, right? Who wouldn't be frustrated by that? I mean, each one of those is like $800 a pop, and they're uncomfortable. And if you don't like needles like me, it's not fun, right? Well, don't be frustrated, okay? I don't want you to be too frustrated, but the reason they don't work most of the time, and I think studies show they work less than 40% of the time to help people with their pain long term. They do give short-term pain relief, by the way. Might last a day, a week, sometimes a month, but they don't give long-term solutions. And the reason why is because they're injecting anti-inflammatory medication into your spine around the nerve. And it's important to recognize what inflammation is. Inflammation is the second phase of the body's natural healing process. There's 4 phases. Inflammation is phase 2. We need inflammation to heal. The body cannot heal an injury without inflammation. And so when you put an anti-inflammatory in the body, it's just inhibiting the body's inflammation response. It doesn't fix the thing that caused the tissue damage or the stress that triggered the healing process. Hence why it doesn't fix the problem, right? Because the problem that's actually causing you to have tissue damage and inflammation is too much movement, too much stress in the spine. And that's usually coming from lack of motion in the hips or the areas above the low back, which is the upper spine. So cortisone injections don't work for most people. They didn't work for me. So if you're out there, don't get too bummed out. The real solution is to get hooked up with someone like me, a physical therapist, who's going to help you move better. Not move your spine more, but move the areas above and below the spine that's hurting so that you can relieve the tissue damage, the stress, and you can heal. Simple as that, right? Most people don't do well with them, so if you're out there and you had them and they're not doing so well, or you're thinking about doing them, you might want to second guess that and find a natural solution. So hopefully you enjoy what I'm talking about. If you're serious about finding a natural solution, all you got to do is give me a call, 231-944-6541. I work with people just like you every day, helping them find a natural solution, and it works really well. So hope you enjoyed this video. Hope that helped you have a little bit of hope, and I'll talk to you next time.